Hi, everyone. I'm Liz Whitehead, Managing Editor of Events at U.S. News and World Report. Welcome to today's webinar on hospitals as community care hubs for autism. Over the course of the hour, we hope to give you an inside look into how hospitals are supporting individuals on the autism spectrum through partnerships, care coordination, transition programs, and beyond. Today's program was developed with support from Texas Children's Hospital. You can learn more about our speakers and see links to past and upcoming virtual events at usnews.com/events. Video from today's webinar is being recorded and will be archived on usnews.com. We're also live streaming on the US News Facebook, LinkedIn, and YouTube channels. Now let's turn to our program. I'm pleased to welcome our panel of experts who are Dr. Lauren Donnelly, Clinical Director at the Autism Spectrum Disorder Research and Clinical Program, and Associate Professor at the Child Study Center at Hassenfeld Children's Hospital at NYU Langone. Dr. Holly Harris, a developmental and behavioral pediatrician at the Meyer Center for Developmental and Behavioral Pediatrics and Autism at Texas Children's Hospital, as well as an assistant professor of pediatrics at Baylor College of Medicine. Dr. Andy Schur, Chief Science Officer for Autism Speaks, and Dr. Kristen Soll, Professor of Clinical Child Health at the University of Missouri and founder and Executive Director of ECHO Autism Communities. Before I turn it over to our moderator, one final note. If you're watching live and have questions, please type them into the Q&A feature in Zoom on your screen. Our team will review them, and our moderator will give voice to some of these as time allows. Now I'll turn it over to my colleague, Michael Morella, Managing Editor at US News, to moderate the conversation. Michael?
Thank you so much, Liz, and thanks to those of you in our audience who joined us today, as well as our panelists. I'm really excited to dive into this topic, and we've got a lot of ground to cover, so I do really want to dive right in. Before we do, we heard a little bit about your title and your affiliation, your titles and your affiliation, but could each of you briefly describe your roles, your organization, and how you're working with individuals in the autism spectrum? Kristen, could you kick us off?
Yeah, sure. Thanks so much for having us. I'm really excited to engage in this conversation. I'm Kristen Soll. I'm a pediatrician at the University of Missouri, and I specialize in development and behavior. And one of my big passions that I think we'll talk about more is how do we make sure that people, wherever they live, whether that's rural America or whether it's different places around the world, have equitable access to autism best practices. And so ECHO Autism was built to really help us do just that. And so I'm excited to be able to talk more about autism and really be able to think about how do we make sure that people who need access have access, and that professionals are able to work together on that as well.
Great, Kristen, thank you. Holly, how about you?
Sure. So as mentioned, I'm a developmental and behavioral pediatrician at Texas Children's and Baylor College of Medicine. And in that capacity, I perform diagnostic assessments and provide treatment recommendations for autistic children and their families. I also serve as the program director for our developmental and behavioral pediatrics training program. So I train pediatricians to become specialists in developmental and behavioral pediatrics. So I too am very passionate about education because I think that's obviously going to play a huge role as we continue to serve our autistic friends and families.
Great, welcome. Lauren, how about yourself?
Thanks so much, Michael. I, as we heard, am a psychologist, and I am the clinical director of our autism service at the Child Study Center at NYU, which is an outpatient center. So I provide outpatient services very similar to Holly. I do evaluations. I also provide treatment, individual, parent work, groups like social skills groups, and working with families, doing sibling support groups. And then I wear a bunch of hats. I am the project lead on what we call the Autism Care Pathway. And that's a project that supports autistic youth in inpatient settings, in psychiatric inpatient settings. And I do training for staff and consultation and dissemination within that as well. Excited to get more into that.
Great. Look forward to hearing more as well. And Andy, how about yourself?
Thank you, Michael, for having us. I'm Andy Schur, Chief Science Officer at Autism Speaks. We're a not-for-profit that is dedicated to creating a more inclusive future for autistic people and their families. And we do this in several ways. First and foremost, we provide current and up-to-date, high-quality information, as well as resources for our community to facilitate their journey with autism. We also provide advocacy at both state and federal level, supporting advocating for a better enhancement of programs and policy that will better support our community throughout the lifespan across a spectrum of challenges. And then third but not least, because the needs are so diverse within our community, and as well as the access to these service and support are still rather challenged for many of them, we are committed to research to make sure that the solution that we have available is accessible by everybody in the community, no matter where they live or how much money they have.
Thank you, Andy. Now, I want to turn to the new prevalence numbers. For those who aren't aware, last month, the CDC updated its data to note that about 1 in 36 children has been identified with autism spectrum disorder, up from 1 in 44 2 years ago. Some have commented that this doesn't necessarily mean that autism is becoming more common, but rather that clinicians and parents are getting better at diagnosing it in children, particularly among underserved communities. What can you help our audience understand about this latest data and just kind of go a layer deeper than sort of the headline? Lauren, would you like to start?
Sure. So just like you're saying, Michael, that prevalence is increasing, and likely this does not mean that there's more people with autism. This likely means that we're better at diagnosing in girls, that we're better at diagnosing younger, and that we're better at diagnosing in underserved communities, and also communities that might not initially seek out that psychiatric or mental health care. So that's likely what's accounting for those numbers.
Great. Anyone else want to add on to that, or we can march forward?
No, I agree with that. And I think the other important finding that really jumped out at me from the report is the fact that even though we have made significant improvement in identifying children from historically underserved community, underrepresented community, it feels like there's still a long way to go. For example, we're still seeing more children with co-occurring intellectual disability in minority children's, which suggests that we're probably still missing many cases on the milder end of the spectrum. So to me, it suggests that we need to redouble our effort to be more intentional in reaching out to this community and double down what we're doing right now so that we can really identify these individuals in need and provide the support and services that could promote a much better well-being and outcome.
Well, let's talk a little bit about what that looks like, all the different ways that that happens at the community level. You all just described a bit about your work, and you represent a wide range of institutions and geography, and our audience too spans the breadth of the healthcare system and landscape. So what are some of the ways that hospitals in particular are playing a role as community hubs for autism care in the places that they exist and serve across the country? Kristen, could you start us off maybe and talk a little bit about your community and Echo Autism?
Yeah, absolutely. So when we think about the role that hospitals play in the work that we do, it's a really important one because frankly, autistic individuals are everywhere, just like anybody else. And so they're finding themselves in the emergency room and an inpatient unit for a general pediatrics reason or other types of reasons. And what I love seeing is that our hospitals are growing more interested and more invested in building their skills to meet the needs of those who have different ways of thinking, including autism. And so one of the things that we do as part of Echo Autism is really start to build those expertise. So not every hospital already has that built in. If you're part of a community hospital or if you're part of an academic center that has a lot of specialists, then you likely have some programs, some similar to what we've heard about from Lauren, and certainly there's lots of really great programs there. But Echo Autism is about saying, how can we partner with a rural community hospital, or how can we partner with an emergency department in a small town or an underserved location and help them also be able to have the skills that they need to meet the needs of people. And so that community hub concept is really important, and hospitals are the leaders really in that healthcare space. And so whether you're a big hospital in an academic universe, or if you're a small community hospital, all have a role to play, because again, I have a belief, and I suspect many of my colleagues on here do too, that doesn't matter where you get your care, they should be equipped to support and serve you just like anyone else.
Holly, could you tell us a little bit about how, the Houston area, but also kind of the wider work in Texas that you're a part of?
Yeah, absolutely. I resonate with everything Kristen's saying. Dr. Soul is saying it's as I serve in an academic institution, a large hospital here in Houston, one of the largest cities in the U.S. We provide our services, of course, here at the Meyer Center, and I'll describe a little bit more about that. But we also find it really important to take that role as educators, not only, like I said, to train new physicians, but also educating family members, educating those in the community. And for us, we do that in the outpatient setting by means of an interdisciplinary team. So for the diagnostic assessments, we're made up of physicians, psychologists, and nurse practitioners who will see children and make autism diagnoses and provide treatment recommendations. And then we have an incredible team of 4 social workers, many of whom are bilingual. In Texas, we do serve a large Spanish-speaking population of families, and they have done phenomenal work to develop education programs. And those span from sessions that occur while a family's on the wait list. So while they're waiting to come see us, they have a waitlist workshop where families learn, what can I be doing now? What might it mean if my child has autism? And then after the child is diagnosed, they provide kind of a part 2 of the visit. So it's a new diagnosis workshop where families can attend and have time to process everything that we've said in the visit, and then think about, okay, what does this mean for me? Next steps with the school out in the community. And then we have actually a visual roadmap that we show families. So at each point in their child's journey, there's a webinar or there's an educational aspect, again, developed by our social work team in conjunction with that interdisciplinary team, that the family can access and kind of go to, okay, what are the things I need to be thinking about at middle school, at high school, at transition. Even we're developing a preschool and an elementary transition webinar, because at each stage there's something. And while there is every child with autism is different, there are some common themes that parents really bring out at those certain age points. So that, that's kind of one way that we're all pulling together, whatever our discipline, to provide that education and longitudinal care. And then often folks in the community will have us come and kind of deliver some of the same information. And then with the availability of virtual and telehealth methods now, that's becoming much more accessible.
Andy, could you talk a little bit about the Autism Care Network and just kind of zoom out the national network that is?
Of course. Thank you. So the Autism Care Network is a what we call a learning health system that comprise of about 21 sites in North America. These are mostly clinical centers and hospitals, large hospitals, as well as other associated organization. And it really provides us with an opportunity to serve as an incubator for innovation in clinical care, to enhance the reach and impact of the clinical and related services and support. And we do so really through research and quality improvement, and great partnership like with Echo Autism and Kristen. We're a big fan of her work. And but what we do in the learning health system is to leverage patient insight and participation to inform priority in research as well as care. For example, our focus on challenging behavior, severe and challenging behavior, really emerged out of that interaction with the community, really on the front lines of care and support that we provide. So these 21 centers, we on average serve about 40,000 individuals on an annual basis. And by leveraging the data that we have, we can pilot hypotheses, we can test hypotheses about ways we can streamline the clinical process, innovate new procedures and so on, that may result in better care and outcome for our families.
You all alluded to this, and I want to dig a little deeper too into, working across the community with so many different specialists, but also government agencies, schools, social workers, other community health providers and stakeholders. That's a lot. And streamlining care and support across this care continuum, across ages, sounds daunting and sounds complicated. what are some of those biggest challenges or barriers you see there? And in particular, what are some of the ways that you're, addressing those and making this care that can span so many different people and players a little bit easier for individuals and families? Lauren, do you have an answer to that? Maybe you could talk a little bit about how things are happening at NYU in New York.
It's a big question, so I'm not sure I have a full answer for that, but I can tell you a little bit about some of the things that we're doing. So in New York State, we have regional centers for autism. So we have 7 university-based regional centers. We, NYU, are the New York City Regional Center for New York State. And these regional centers provide different trainings, presentations for professionals, for parents, for autistic individuals to provide information and really evidence-based information on diagnosis and treatment and really accessing care. And this is just one way that throughout the state, we're really trying to have a broad reach. One of the things that was really, I think, a benefit of the pandemic telehealth movement was that most of those really went virtual. And we've been able to reach a much broader range of people and more people by having those presentations in a virtual format. But that's just one thing that we're doing, and it's statewide and is funded by the state. So there's a lot of overlap there with the different agencies that you just referred to.
Kristen, I wonder if you could talk a little bit about that too, and thinking virtual, thinking about autism. How do you kind of straddle that line or think in kind of both modalities?
Yeah, absolutely. So I've had the pleasure of being able to serve children and families via telehealth, traditional one-to-one telehealth for about 15, 20 years. The pandemic certainly made that a much more common adventure, so it didn't sound as cool anymore. But I certainly think there's a major role for being able to serve people right where they live. And I think when I think about that, there still continues to be a significant capacity issue, right? And so when we think about workforce and we think about workforce development, and going back to your question about teams and all of the incredible professionals who are meeting the needs of autistic people and their families day in and day out, social workers, speech therapists, occupational therapists, teachers, nurses, doctors, all of the whole gamut, right? I think one of the important things that we have to recognize is that we have a massive workforce shortage of individuals, professionals who understand and can meet the needs, meaning meet that individual person and or family where they're at. So one of the things that we do is we use virtual, it's not telehealth, so it's not one-to-one, but it's a type of virtual, we actually call it telementoring through ECHO, and it stands for Extension for Community Healthcare Outcomes, Autism. And one of the important things about that is that we are trying to build professional expertise or professionally develop a whole host of multidisciplinary people out in communities, so that when a child or an adult has a question about what's going on, it might be about their development, it might be about behavior, it might be about maybe it's about one of the medical co-occurring conditions, diet or sleep or things like that, that there are actually people in those communities, wherever that might be, that have the ability to answer some of those questions. And then when they don't know, the capacity is more accessible at our centers, like in Houston, like at the University of Missouri, places like that. And so that's one of the big things that we're trying to do is say, let's build the capacity. On the flip side, just because I want to get the equity concept in there too, I do fully believe that every child with autism should be seen as a child first, and therefore not as an anomaly or as something that's like, well, I don't know how to do that, you have to go someplace else. Instead, it's like, I got that, right? So as a pediatrician, I want pediatricians to say, oh, no problem, I know how to help you. And that way it's less of this kind of rare notion, because it's not rare. And so it's an important thing for us to continue to work on that and changing the current paradigm.
To jump off of that, I think we're pretty committed here at the Meyer Center to empowering our pediatricians and those out in the community to take that role and be confident in it. Because I think a lot of times we are kind of the expertise, the consultants, but a big push behind all of our programming and education is this is kind of your everyday pediatrics. These children with autism are in and out of your practice, every day, considering the numbers we just heard. So, and we're all capable of serving them well. And how can we ensure that our pediatricians and other providers feel empowered? And so we have, given kind of the things that have come out of the pandemic in terms of telemedicine, we have started to run some pilots of like teleconsultation to our pediatricians. Those have been contained within the Texas Children's practice right now, because that's the place to start. But how might that work, where we could kind of be a phone a friend for a pediatrician? Or we also thinking about how to support people across subspecialties. We do now have an inpatient team that's built of doctoral level or master's level board certified behavior analysts who their primary role is patient care. So if a patient is admitted with kind of a behavioral crisis, then they can go in and do a functional behavioral assessment and support that the patient and the family. But another big part of their role is educating folks in the hospital, anywhere from PCAs, nurses, the interdisciplinary staff, subspecialists, and MDs. And so just kind of like everyone said, all kind of play a role in this. And so wanting to make sure that everyone feels empowered and that they have the skills to do so.
Yeah, you both mentioned a couple points I want to return to if time allows. But, thinking what you just said, Holly, about, given that autism is often characterized by co-occurring conditions, GI disorders, depression, anxiety, and much more, are there things that you all have implemented or seen at your own institutions, or Andy, at the many institutions that you all work with, that help kind of break some of those silos down, or help, make the process of, scheduling, diagnosis, scheduling, and ongoing treatment a little easier for families and also for the providers themselves? Lauren, I see you nodding, not to pick on you, but could you shed a little light on that?
Sure. So I think that this is pretty similar to some of the things that Holly and Kristen were mentioning, and we have some similar systems. So I think we really want to empower providers that are not, that did not go to school necessarily to become an autism specialist, to also feel really comfortable with working with patients on the autism spectrum, and to do that in a variety of settings. So, I think that what differs sometimes between inpatient and outpatient that we've seen is that outpatient is typically scheduled. These are typically scheduled visits. Sometimes inpatient is an urgent need and is not scheduled. So we might not know ahead of time that someone is coming in for with the seizures, with GI issues, things that are pretty prevalent within this community. And we might need to do a quick assessment to really help support both the family as well as the providers. So this is something that we teach others, to gather information really right off of the bat about a child's needs, their emotional needs, their behavioral needs, their language needs. So we ask questions about what the child understands, like their receptive language, about their expressive language abilities. And we also ask questions about their behaviors, like if there are any unsafe behaviors, if there are warning signs of behaviors, what triggers are, so that we can avoid those things, and also what helps to calm them. And we want to know like what they like doing, what do they enjoy. If they're going to be staying overnight, we also like to know, or just for an extended period of time, we like to know what do they like to eat. So we have a bit of a picture of the individual, and then we can make more of a behavior plan. And one of the things that gets to your question about how can we help families out, we want families to not have to repeat this time and time again every time a new person comes in the room. So we want to make sure that providers are sharing this information to each other, whether that's like within their huddles or if they're doing that within an electronic medical system. Some places will put a sign in the room that talks about the family and the child's needs. And this is all really to help out to reduce the child and the family's stress and their really fatigue with saying this information over and over again. And so that we can prevent those challenging behaviors, some of the things that Andy was referring to earlier. So if we know that having 10 people in the room, which sometimes happens in a teaching hospital, is going to be something that's overwhelming in a sensory way and triggering for a child, then we're going to let others know that. And we're going to make sure that, 1 or 2 people go in the room.
Another way that at Texas Children's that we are kind of seeking to support families considering the frequency of co-occurring medical conditions in autistic youth. So we know that there are certain maybe outpatient visits or inpatient visits to perhaps GI. Our GI providers, neurology, maybe sleep medicine, or certain procedures that the children might be having done in the hospital setting. One of our current developmental behavioral pediatrics fellows, alongside the psychologist on the inpatient setting, are working on developing some general kind of social stories or visual representations of what that event or procedure might look like, whether it's a sleep study or an EEG. And I know hospitals nationwide have started to kind of implement this idea, but that's one simple way that we could perhaps, help families prepare for some of these necessary medical assessments that can be a little bit overwhelming or stressful.
I'd like to add to that. I think certainly agree with everything that's been mentioned by my esteemed fellow panelists. I think our Autism Speaks perspective is that one of the perhaps most enduring barriers for to well-being and better outcome for our community really has been timely access to feasible and effective intervention, and that remains a challenge for our community to this date. And at the root of it is really because of lack of innovation, we think, in service delivery as well as the content. That's why part of the reason why we're such big fans of ECHO really is an innovative way of delivering services to our community. And again, I think that's really been highlighted, especially during the pandemic. But also, I think there's a lack of equity-focused community-based interventions, right, that could enhance our the dissemination and implementation of these proven solutions in these communities that have difficulty accessing healthcare in general, as well as the solutions. As an example, we have worked with the World Health Organization to develop what we call the Caregiver Skill Training Program, which is taking a cue from what Lauren mentioned earlier about better engaging non-specialists in this work. Is really targeted to take evidence-based intervention to break it down systematically so it can be taught to non-specialists and be delivered in the community setting. And this has been a very successful program. It's really leveraging a public health strategy of task sharing. And so far, this program has been piloted in over 30 countries around the world and has been scaling up in a handful of countries now. And we have started with help of colleagues like Kristen and other programs to implement this in the United States in some of these really underserved communities as well. And the idea is really to empower non-specialists, including caregivers, with actionable knowledge, right, that can actually promote better well-being outcome for these families. And the fact that this intervention, because it's focused on the training of caregiver, it is adaptable so that it can be informed culturally, right? So they, as well as informed by local limitations for infrastructure, for example, capacity and access, so that it can really try to fill the void that's there currently in the service delivery models, and provide access to those who are historically been left behind, a chance to the services that can really be transformative in their well-being.
Yeah, I'd love to stay with that concept of, equity and access. How can providers ensure that effective care is being delivered in an equitable and accessible way and reaches patients and families of all backgrounds? Thinking back to where we started with, the prevalence numbers and the implications of that, what are some other ways that you all have practiced this or seen this at your own institutions or at peers? Kristen, I don't know if
Yeah. Sure, I'd be happy to. And, I'm piggybacking off a little bit of what others have said, but also thinking about this, the opportunities for innovation are huge. We have a lot of research that's been done over the years on various effective interventions. And that's great, but we have a long way to go to get that out into the hands of real world people. And so I think that's a very, very important place that we all as experts in this field need to give very significant attention to. What I think that's also really important is thinking about, and it's a common phrase that I think through, which is essentially, what can we do, right? There's a lot of things that are barriers and problems and what have you. There's also a ton of things that we can do. And I also like to focus on what can our autistic friends and families be able to do. And so there are a lot of incredible autistic adults all across the spectrum that frankly can be very effective in helping the parents and caregivers of younger kids have insight into what it looks like to be on the spectrum, how it thinks, or how they think, and how they have been able to navigate this world. And so I think there's actually a lot of innovation to be had around engaging both caregivers and autistic adults in this space, where we say, you know what, let's learn from each other. We do the same thing in mental health. We do the same thing in cancer survivorship, all of these things. And I'm not equating cancer and autism. I'm suggesting that we can learn a lot from people with lived experience. And so really thinking about that lived experience and what can that do to help us move that knowledge out to communities so that we're not insisting that everyone have to come to the hubs of expertise. And I think just to emphasize that in just a slightly different way, I think oftentimes we're thinking about autistic individuals as having deficits. We are physicians and psychologists, most of us. And so unfortunately, that is how we're trained, but that can-do spirit of like, well, yeah, I mean, there may be a different way of thinking, but what can we do to foster skills and development that allows that child or that person to thrive in their community? That may look very different for lots of people, but it looks different for me too, right? Like, I bet I do things that are different than Lauren and different than Holly. And so it's certainly fine. And yet my community embraces that. And so what I look forward to is that innovation catches up, kind of like what Andy was talking about with this population health approach, to say, like, these kids are everywhere, these people are everywhere, and they don't need to have kind of kid gloves on when you're interacting with them. Let's learn together, let's innovate together, and keep creating those environments where everyone can have an opportunity to thrive.
Michael, can I build on that a little bit? I just want to really further draw out the point that Kristen made. I think is really important. The idea that we can learn from community members, right? This whole model, I think, has becoming more robust and more prominent in recent years. Participatory research, where you really engage community stakeholders, caregivers, family members, service providers, as equal collaborators to co-produce solutions to a common challenge. Because what that will result in is the solution will be much more relevant to the needs of the individual. You can benefit from the lived experience that Kristen highlighted, that many of us don't have, right? From autistic adults and family members. And accordingly, the idea is that then you can produce a solution that's a much better chance of being sustained going forward in the community setting.
I can build on that a little bit as well. So I think that what we're kind of talking about, and Kristen, I think what you were describing is that neurodiversity and how there's really a call to action, I think, in the autism, in the neurodiverse community to be hearing these voices and using these voices. And I think it's one of the most exciting prospects about the field right now. So I'm really looking forward to that. And I think something that Holly was saying earlier, and also Kristen, we sometimes look at this medical model of autism and we use our DSM-5 to diagnose. That is many times that is built on looking at deficits, as Kristen was referring to, and that in order to help and really support in these community hubs that we've been talking about, one of the things that we can do is really try to build on someone's strengths. And I think that's some of the stuff that we have heard from autistic individuals and from community members, from families, like Holly was referring to, the use of social stories and the use of visuals. So I think everyone's nodding because this is something that we all do to really support the strengths of an autistic individual. Many individuals that are on the spectrum, no one is the same. Many individuals really respond well to visual information and possibly better than verbal information. So using those social stories, using those visuals, and helping someone to advocate for themselves, I think that's where we're going to see a lot of change. And that's how we can help in these community mental health settings and in these community hubs, by really building on the strengths of autism.
We have a question from someone in the audience that I think is relevant. I'll ask it, and maybe Holly, I'll pitch it to you first. Someone asks, how do you actively engage family, community, and natural support surrounding a child to truly understand the intersectionality, race, gender, socioeconomic status, culture, and so on, of their daily lived experience? You all are talking in that direction, but our listeners, Holly, could you talk about that?
Yeah, sure. I think that's a huge question. And I think that honestly, my first thought is we just need to ask and consider it. I think, for many years, everyone's alluded to the medical model, but just to think about each of those pieces and how it plays a role. And yes, we can, as a developmental pediatrician, I can see you in my assessment and provide a lot of great recommendations. But when you walk out of my door, what does that actually look like for you as a family? What does that look like at your school and your community? What are your barriers? What is your, based on your ethnic background, what might that mean for you culturally? And all of those things are going to play a role and are actually key in knowing what are the things that the child and family need, what's important to them. Again, thinking about that strengths-based approach. So what are the things that are challenges that we can support you in? And then what are the different strengths and things about your child uniquely that we want to foster? And I, kind of to use a moment to piggyback on what everyone's been saying, but as a medical educator, I harp again and again on education. But I think another way we can think about equity is training the people well that we interface with. We all are in some type of role where we have people who probably come through to learn from us. I know at Texas Children's, I have an advantage because we have one of the largest pediatric residency programs. And so I have hundreds of residents that come through, and each are required to do a month with us. And many of them are very excited to be here. And that's their opportunity to really learn as much as they can about children with neurodevelopmental differences, autism being one. And that's a chance for us because those individuals are going to go out. We don't know where they'll end up, but they're going to go out into the community. Maybe they'll be rural providers. Maybe they'll go elsewhere. But we want to empower people to carry that knowledge with them, that then will kind of promote equity of care across the state of Texas for sure. A lot of our residents do stay here, but I think that's just a wonderful opportunity to make sure that we're empowering learners that we interface with on a day-to-day basis.
I'd love to talk a little bit about staffing. Kristen, I think you brought it up a little bit earlier, but Holly, to what you're just describing, filling roles, managing retention and turnover, are there solutions you all are implementing in that regard? And actually, another audience question, another audience member asks a related question. Would this group be able to offer any insight into strategies to help providers balance the increased services they might need to provide, especially with recent literature noting that primary care physicians need to work more than 24 hours a day in order to meet needs? Any insights into how kind of to juggle all this and how to provide some of that education and strategies that will engage people in the medical community?
Yeah, I'm happy to start off with that one. I also am, a professor of medicine, so I teach medical students and residents all the time. And I think what I see, and getting to the idea of how in the world are we supposed to do all this, if a human being is supposed to work 26 hours a day, I'm not sure how that works out, although I'm sure several of us on here have tried, myself included. And so when we think about, all right, what does it mean to be practicing pediatrics in this century? What does it mean at this moment in time to be practicing pediatrics? Well, right now it means that we have a lot of development and behavior in our outpatient clinics that, frankly, as pediatricians, and I'm just speaking about that space for a second, so pediatric clinicians, nurse practitioners, physicians assistants, pediatricians, and family physicians. So thinking about them, we have almost no training, except for that 4 weeks that Holly mentioned. That's all you get in your entire training to become a pediatrician. That's not enough when you go out into your practice and it becomes the dominant aspect. So, and why is that? Well, yes, it's true. We are in the middle of a national pandemic for mental health issues, but also we've gotten really good at keeping kids healthy. Our asthma rates are better. Our infectious disease rates are better. So again, that says our workforce has to adapt to what we see most now, which is, again, many of the mental health, developmental, behavioral concerns and things like that. So when thinking about the workforce, it's not just about your physicians, but it's also about thinking through who else is out there? How else can we work together? And so, of course, I'm a big proponent of the ECHO model, which essentially is all about moving knowledge, not people. And so this idea of saying, okay, listen, yeah, I'm an expert and I can teach lots of people about the things that I do and the things that I know, but I need to empower them to truly know how to use it, feel comfortable with it, and then have that confidence to do it on a regular basis. So when we think about those hours in a day, yeah, it's true. None of us can humanly work 26 hours in a day. However, the more comfortable you are with doing something and the less scary it feels when it runs in, when that person or that topic comes into your clinic, the much more efficient you can get at it. And so I think that's one of the big gaps that we have. And there's no way I can deny the fact that pediatricians and pediatric clinicians work their tails off. However, when you don't have a lot of confidence in your ability to address development and behavioral issues, it takes longer. And so that's a huge thing. Now I'm not addressing some of the bigger issues too. We also have massive healthcare system issues. The amount of paperwork, the amount of denials and all the different things. I could spend a whole nother time on that. But just focusing on that workforce, it's really about partnering. Yes, of course, working with our trainees that are our captive audiences and get to work with, or have to work with us is important, but it's actually about the workforce that's already out there. How do we support them where they're at? How do we give them the tools and the skills to do the things that they need to do? And that goes, again, beyond healthcare. That's education, that's therapy services, that's all kinds of things. So I'll stop. It's my favorite topic. So thanks for letting me talk on it.
Can I point out something of Kristen's that I just want to really drive home? I think one of the things that we know from the research is that doing a lecture, giving one training, and then stepping back is not enough, that we actually need that ongoing consultation. So that's something that the ECHO model does, and something that I think a lot of us do within our work. So setting up systems where people can come to you for ongoing consultation is actually going to help them deepen their knowledge and widen the breadth of the types of cases that they really feel comfortable with. So I just wanted to drive that one home.
I'd like to add to that. I think maybe one thing we should consider is also our definition of workforce, right? And I think the challenges with building a specialist workforce is time and resource intensive, and the delay that's involved often translate to the fact that many families will not be able to benefit from the care that they deserve. I think and it's also clear that, not every child or family affected by autism need the same level of care. In the recent Lancet Commission report on autism, the recommendation was made to look at a step care system, which will allow us to more efficiently allocate scarce healthcare resources, including human resources, to better serve the community. And part of that thinking too is also, going back to the conversation we had a little earlier, is that maybe we could think about being more flexible on how we define the workforce. Non-specialists, for example, we talked about them a couple of times in the conversation already. Clearly, research shown that they're capable of delivering high quality support, including behavioral intervention to our children and autistic people, right? And that will really help us address some of the capacity issue that we currently have and the access issue that we currently have. And plus, you can take advantage of their lived experience, their knowledge of the community and the culture, and so that you can actually provide even higher quality care by leveraging the non-specialist workforce that are involved at this point. So I guess my pitch is really that for us to think more broadly about how we define workforce and be open to the idea that, we can think about different ways to delivering quality care through different mechanisms at this point.
We've got about 15 minutes left, and I want to try to squeeze in a handful of other questions if I can. First, what can you all tell us about how your organizations are helping individuals and families navigate the transition through childhood to adolescence and to adulthood, as well as continued access to necessary support services or community resources after age 18? I know that's another big question. I don't know who, Holly, would you care to start us off there?
Sure, I'll jump in because we've been thinking a lot about this lately. And we kind of have an advantage of having like maybe an ideal setup at Baylor Texas Children's, because we actually do have an adult neurodevelopmental disabilities kind of whole section or transition medicine section at Baylor that is dedicated to this very issue. So we talk early, and again, the team here at the Myers Center, the interdisciplinary team, particularly our social work team, we introduce that idea of transition to families kind of at the beginning and kind of talk about those many transitions along the childhood and youth trajectory and what each of those looks like. And then, yes, there is this big transition at 18 kind of legally into adulthood. And but starting that discussion very early, I think is extremely helpful and important. We know that there's frankly just a very distinct kind of drop or sometimes difficulty in accessing services or even healthcare providers who are comfortable with autism when kids enter the adult world. And so again, right now it's very, very much kind of that model of like, how can we impart the knowledge to others in the community? But a lot of discussion of how we can use telehealth and kind of like this telehealth consultative model for our adult colleagues as well, given that we have kind of this ideal unique perspective here with physicians that are particularly interested in adults with neurodiversity.
I can jump in on that. As a clinician, the clinical work that I do is I do a lot of diagnosis, but then I do longitudinal follow-up. And I like to joke that as I get older, my patients get older. And so now I have a whole bunch of little kids that are now big kids. And so this is another really important thing. And I think it's about preparing the autistic youth and their parents to understand transition and what that looks like along all of the aspects. So healthcare, workforce, or not workforce, but work, employment options, post-secondary education, different things like that. So honestly, I usually start talking to my patients pretty darn early, like around 10 or 11. And honestly, it's a lot about empowering them. It's a lot about saying, here's, and again, I have a broad spectrum of people on the spectrum that I serve. And I apply the same principles to the entire spectrum. Of course, that's going to look different depending on who I'm sitting with. And yet it doesn't either. So it's about figuring out, what does a meaningful life look like like for that person that's with me in that room and as we're starting to prepare for that transition. Now, I will say that empowerment is only part of the solution. So really working with someone to determine self-determination, so help them make those decisions in the context of their family and their culture and those things, that's part of the issue. But to be honest, our systems are poorly designed to serve kids at the age of 18. I have a 24-year-old, and I can guarantee you that he still needs support, right? Like he's still, and when he watches this, he'll be like, thanks, mom. But you know, the bottom line is 18-year-olds are not really ready to completely go. And so the no different, if you've got a ton of supports and services for someone with autism, all the way up until 18 or 21, for example, and then just whoo, because you hit a certain age, you miraculously don't need that anymore, that's super silly. And so it's one of those things that I think as a healthcare system, but also integrated with payers and our states have to be thinking about, because frankly, it's not okay to say to a family and a person that, yes, we recognize you need these supports, but just because you turned a certain age, you don't get them anymore. That's not okay. And so our states, whether they realize it or not, are entering into a space where we have a lot already do, but are going to continue to have many adults who have additional needs. And so we've got to hurry up. We're kind of behind the 8 ball in this one, and figure out community-based solutions, opportunities for people on the spectrum to make meaningful contributions that are meaningful both to them and the incredible skills that they bring to our communities. And so that's a really important piece to this transition, and something that, again, it's easy to talk about. It's a whole lot harder to do, but it's very important for our work.
Yeah, I completely agree that it's a huge challenge, you know, for our community. And I think the intensive investment in research, as well as developing various service model is really a testament to the urgency that we need to meet these needs. Often speaks, you know, I mean, I think one of the solutions, as Kristen and Lauren alluded to, is really information, right? I mean, both in terms of understanding, awareness on the part of the community, as well as autistic people and their families, of the challenges ahead, and what they need to think about, what they need to prepare about. So we do provide these expert developed toolkits that are related to transition support, everything from medical transition to school to work transition. Employment toolkits, for example, really offer autistic adults, interested autistic adult tips, as well as other tool to help them plan the employment search, how to determine the right job, and so on and so forth. We also provide similar toolkits in housing residential support. Admittedly, that's still a younger area, a newer area of development, and a lot more work and research to be done in that particular area. But we try to provide them with some information about the kind of options that are available to them in housing longer term, and kind of support and service that a autistic adult may need for them to really be able to function more successfully in the community setting. And then and finally, you know, another example is that we have a workplace inclusion now initiative, which is really the integrated employment model. And it's not just about providing autistic people with the skills and the information and the tools that they need to become a successful employee, but it's also about sensitizing the employer, giving the employer the tool, the understanding, the ability to create accommodation so that these employments of autistic people can be successful in their business. And of course, that will not be successful if there's no broad community understanding support for this kind of work going on. So those are some examples of what Autism Speaks is doing to facilitate this transition to adulthood. And one last point, however, sorry.
No.
I think we also need to really raise awareness, really thinking about transition throughout the lifespan. It feels like, you know, when we talk about lifespan solution right now, I think truthfully, we're only talking about half a lifespan. A question I like to ask people is that, what does an autistic adult with dementia looks like? Nobody knows. What are the tools that can effectively identify an individual who are at risk with dementia? Nobody knows. What are the standard of care? that best support individuals with neurodegenerative conditions, autistic adults? What are the common comorbid health issues that need to be addressed? What are the prevention strategies that are available to all of us, but not available to this population? What can we do to facilitate that final stage of transition in the life of autistic adults? I think that's something we need to start to really invest and think about as well.
And I was only going to put in a plug for the work that they're doing over there at Autism Speaks. I attended one of your webinars the other day and learned about some of these kind of newer toolkits around employment, and it's just really such a great resource.
Another question. Do you have any actionable advice for the healthcare community, again, many in our audience, about the best ways to battle misinformation and disinformation, and to ensure that individuals and families get the most scientifically sound and evidence-based information for them? Lauren, would you care to kick us off there?
Sure. Yeah, I think this is a great question because there's a lot of information out there and it's really difficult to know how to process that information. So as we were kind of talking about earlier, I think seeking out information through academic medical centers can be a great way to access evidence-based information. You can also, you can check on the like NIMH if someone has funding through there and can look that up publicly and see what their studies are. There's also organizations, you know, nonprofit organizations like Autism Speaks, like the, you know, so like the Autism Science Foundation that provide really beneficial information for families, for autistic individuals and for professionals. So those are just a few of the different resources. I think for professionals, as we've been talking about, also, you know, getting connected, like through the ECHO network, that's something that's going to be really beneficial for them in the long term.
One more question from someone in our audience. Have you found success in connecting adults, kids, teens, people across kind of an age range with autism to build community that way? Is that something that, you know, you all have seen in the places you're working?
Yeah, I can speak to that. And so, you know, when we think about the breadth of, again, the individuals that are on the autism spectrum, it's huge. It's no different than the rest of our human population. And so I think when I think about the opportunities for autistic people to get to know each other, and that could be any space on that spectrum, frankly, some of them enjoy each other and some of them don't. No different than, I like to joke, if I got together with a whole bunch of anxious women, I'd like some of them and some of them I wouldn't, right? Because that's human. And so thinking about autism and thinking about how we are supporting autistic adults and teens and youth in getting together, and allow, what I think is a really important piece here is allowing that to take shape however it takes shape. I think that's an important thing to understand. And so, yes, I have successfully worked with highly verbal autistic people who are working with less verbal autistic people. And you know what? They get each other. And is it, again, though, just like I'm not going to automatically get someone who's supposedly like me, it's not an automatic. And so, and I think that's frankly kind of rude in a lot of ways to suggest that, I'm not saying anybody of us suggested it, but some people will be like, well, they're autistic, they should like each other. What? That doesn't make any sense, right? And so thinking about like, how do we make opportunities available and allow that to happen and allow those relationships to grow however they grow. And I think that's an important thing for us to think about. Again, some of these things that we're talking about here are oddly enough very innovative, and it's sad because they shouldn't be. The opportunities here are huge to say, you know what would it look like if we had an, you know, an autism social around, you know, video games or do whatever. And I know there are lots of organizations that do that, and just let it be, right? Don't force them to have conversations with each other. Don't, you know, make prompts and whatever, just let it be. And I think that that's an opportunity too. Or imagine those that have maybe not as many verbal skills, but they clearly have interests and exciting things that they like to do. Let them be. If it's Elmo, if it's whatever, if it's watching the same, I have some kids who really love to watch YouTube videos about different sensory experiences. Right. And I can tell you that they love letting me watch that stuff too. So they're interested in other people engaging with them in their interests. So I think the summary to that would be meet them where they're at. Right. So let people be and let that organically take place.
We're running up on time, but I want to give you all a chance to make just a final comment. If you've got any final parting words for practitioners, your peers, for parents, for individuals, maybe Holly, we could start with you.
Yeah, I think it's just been a pleasure and honor for me to even be on this panel with other individuals here, and it just gets me excited hearing about what they're doing in their various arenas. But I think, for those of us who are out there and who care about this, obviously you attended this webinar, and I'm just encouraged by the interest around it. And I would just empower you to, the knowledge is out there. Look in your area, see if there's any echo autisms that are going on, see if there's anything there that you might can join and become a part of, and kind of start to get that consultation around and that education that then empowers you to be confident in handling it. Just as Kristen and Lauren and Andy, we've all been saying, we all have a role to play in this. So look for ways to get that knowledge and that experience.
Andy, how about you?
Yeah, and to me, I think it really this highlights the power of community, right? And that I think the challenges are so enormous, and it's clearly not individually, we're not able to meet the challenge. Only by working together, only from learning from each other, being open and humble, are we able to make meaningful progress. And we really need to listen to autistic people and their family to help guide us so that the work that we put in is relevant and directly related to the needs that they need to address.
Lauren?
Sure, thanks so much. So I 100% agree. I think we need to be hearing from autistic individuals and their families, and that they are their best advocates. So to keep those voices heard and loud, I think that's one thing that we need to keep doing. I think we need many more professionals who are excited about autism and learning about autism and can do autism evaluations. We don't have enough individuals, so I love to hear about the work that my colleagues are doing in terms of training the next generation of trainees, because we need more people. And then last, I'll say that we didn't touch on this so much. We talked more in the medical and the peds realm, in terms of psychiatric care as well, and in inpatient psychiatric care, autistic individuals are accessing those services at much higher rates than non-autistic individuals. So within that realm as well, I think we need to be continuing to empower, because we're seeking out services there. So we also need to be training and having consultation models within that realm. And we've seen wonderful success when we do, even on general child and adolescent inpatient units. So thank you all, and it's wonderful to hear from all of you as well.
Thank you, Lauren and Kristen.
Yeah. So I think, first of all, again, thank you for having us. It's been a real honor to be here and hopefully share more with the community so that others can understand about the really awesome ways that autistic people think and how important understanding that is. So I think that's what I would leave everyone with. And thinking about what are the steps that you can do to take more steps toward understanding autism. And that means trying to put aside the stigmas, frankly, the stereotypes that have pervaded our media and other things like that. And so what I would encourage you to do is get to know an autistic person. They're amazing. I am so lucky to get to do the job that I do and work with the people that I work with. And so I would encourage everyone to think about what they can do. So if you're a doctor, great. Think about what you can do. If you're a parent, great. Think about what you can do. If you're an autistic teenager, I hope that you will find somebody out there and just inundate them with the cool things that you know and all the neat things that you are able to do. And I think those are the really important pieces of what we are able to do. And I would just say engage, get out there, learn more, and stop letting bias and stigma really cloud the idea of autism, because I think that's really holding us back.
Well, thank you so much, Dr. Kristen Soll, Dr. Lauren Donnelly, Dr. Andy Scher, and Dr. Holly Harris for making the time for sharing these great insights. We're so appreciative of the work you're doing. And for those of you in our audience, thanks for making the time to listen in about it. Hope you can join us again soon. Thank you.
Thank you
Very much.